Hello, welcome to the CIRS Healing Collective Expert Guest Video Series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a Shoemaker Proficiency Partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you.
Like, you know what? If I'm going to do herbal medicine for my son, I'm just going to do it myself with Buhner's guidance, Julie's guidance. And that's how this whole process started. Brian went from strength to strength. We lost the diagnosis. He started growing again, started gaining weight. I mean, oh my gosh, I always say he went from the spectrum to the honor roll. I mean,
Wow.
It took 7.5 years because I was learning, what I bring to my clients at the first appointment is what we went through, the one ordeal after another for 7.5 years to help my son. 2014, I met Dr. McMahon. I had heard about Dr. Shoemaker a few years back, but I never had the chance to proceed with the treatment because we were so severe. But, turns out that would have been a great idea if I had started the CIRS protocol. So we were on the CIRS protocol. He responded really well. His brain MRI looked like a 65-year-old with Alzheimer's.
Wow.
He was 9.
And how old was he at the time? He was 9. Wow.
I know how to read MRIs. And I'm like, hey, take it back. Whose MRI have you given me? So she's like, no, Dr. Dashore, this is Brian's. I'm no. He's 9 years old. She says, yes, I'm sorry, but this is his MRI. And it was just, I remember Dr. Shoemaker reassuring me that, he's young, he'll be fine. 2.5 years later, his MRI came back normal.
Wow. So he had been on Stephen Buhner's protocol, and that's more for Lyme, correct? The Buhner protocol, the herbs for Lyme. So he had been on that, was making some improvement, and then he starts doing the Shoemaker protocol and sees more improvement. And that's where we saw such a big shift in his brain MRI while he was on kind of both the Buhner and the Shoemaker protocol. Is that fair to say?
Correct. He was on both. Yes. Focus isn't just autism, but that is, it's also tick-borne infections, tick-borne diseases, biotoxin illness in patients of all ages. What I see is once children start to improve, and not just autism, language, autism symptoms, we actually see all of CIRS markers, TGF-beta, C4A, MMP9, they're all resolving with just a completely plant-based approach. What I typically see is, we tease out all of the triggers for a biotoxin illness, right? Do I have patients who don't recover more than 90%? Sure, all the time. It ranges anywhere from 30 to 95. And there are so many contributing improvement, correct? Yes, especially if there are underlying issues, and it's very evidence-based. We run labs. We establish a completely customized plant-based protocol for each patient. Even twins and triplets have their own protocol because their labs differ. When special needs children go to a special needs classroom, almost every other child is, the family is unaware of PANS, pandas, biotoxin illness. So many children are strep, mycoplasma, staph carriers. And that transitions to exposure for my patients.
Oh.
So it's a mixed bag.
Let alone mold and actinos and whatever else
exactly,
you might be
mold
carrying.
and actinos and strepto and all of those. Exactly. Yes. Yes. Like we've had to provide air purifiers since first grade for my son's school, all his schools, even now in college, he has a 504 plan. So it's been a battle, with having advocates and attorneys, and me being who I am, so at least the school nurse listens to me.
Why do you think that biotoxin exposures can manifest as autism in some people? What do you know what the mechanism is there? Or are there other things that usually are also happening at the same time, like certain genetics or vaccines or stress, other things that make it so that a child can end up with autism because of an exposure early in life?
Yes. Genetics, environmental toxins, epigenetic exposure. You mentioned vaccines. A lot of mom's toxins pass in utero. Tick-borne infections, when they cross the blood-brain barrier, can mimic autism. PANS affects the basal ganglia. Lyme disease is one of the triggers for PANS, along with many co-infections.
Yeah.
CIRS also affects the basal ganglia. So a lot of symptoms of autism can actually be symptoms from biotoxin illness or PANS that are disguising themselves as autism symptoms. It needs a discerning eye of an experienced clinician.
We'd love to know, knowing that you're Shoemaker certified and you know all of that, but you prefer to use the herbs that you've been trained to use towards the same end. And you've probably come up with some of your own therapeutic interventions specific to Lyme and autism. Will you tell us a little bit more about some of the things that you use and see great benefit from?
Well, we run labs to look at all the possible triggers that I mentioned earlier, right? The epigenetic, the multimicrobial, environmental toxins as well. Now, the herbs that I use are the blends, the blends that I formulated. So I have about 32, and I have 3 more coming out this year. So that makes it 35 unique proprietary blends that are that I use. One example would be biotoxin detox blend. Then another example would be Formula 1 nasal spray for Marcons, right? So these are all. I also have glyphosate detox. We have anxiety blend. We have a speech blend, and so on and so forth. So this is a combination of Ayurvedic and Western herbals, which my PhD thesis was all about herbal medicine for autism spectrum disorders.
Okay.
So that is how the protocol is built, and it works really well. I mean, we look at the labs and the herbal combinations, the herbal dosage, any add-ons, right? Detoxification or essential oil or camel milk. These are all added on at the right time. Looking at the full clinical picture with herbs, it is important to establish a sort of a prioritization. So if the labs show up with C. diff, as well as let's say strep, staph, giardia, mycoplasma, klebsiella, so on and so forth, sometimes I'll see morganella in the labs. Now, when that happens, I need to decide what to prioritize based on, I guess, I mean, I could lecture on this for hours, but right, because there's,
So
bio-individualization is so important, because how old is the child? What is the exposure? What is the clinical functional level of the child? What is mom and dad's priority? Of course, everyone wants their child to speak, and that doesn't necessarily come first. So based on that, I prioritize based on the labs, as well as so many other variables that I prioritize the treatment.